Welcome back to the Colours of Parenthood. In this episode, we're joined by Jessica Peterson, an incredible health occupational therapist. Jessica shares her surprising experiences navigating the challenges of motherhood and how those inspired her to develop a platform that supports new moms during the postpartum period. Let's dive in! Hello everyone, to my podcast, The Colors of Parenthood, with Jessica today. Jessica, could you please start by introducing yourself, a bit about your background, and what do you do?
Sure. Thank you so much for having me. This is very exciting. My name is Jessica Peterson, and I am located in Austin, Texas, in the United States. And I am an infant and maternal health occupational therapist. So that means that I work mainly with mothers and babies in the first few months of life, from preconception all the way to the first 6 months or so of life, to help them do their occupations, which basically is anything that they do during their day, which could be anything from feeding the baby to taking care of themselves, to play and bonding.
Fascinating. And are you a mom yourself?
I am. I have two little girls who are now 6 and 9, which are very fun ages. It has changed a lot.
And being an occupational therapist now, did you need this support when you were experiencing the struggles of being a new mom?
I didn't know that I needed it until I went through it. I was an occupational therapist first and a mom second. Um, but looking back, it is something that I absolutely could have benefited from. What I do as an occupational therapist is I kind of start a conversation with moms, ideally before they even give birth, about sort of what is going to help them function their best, and heal their best after birth. So that might include setting up around the home, but more than just the nursery, but how to set up a healing space for the postpartum period. What are you going to want right there bedside, that's going to help you with your pain management, that's going to help you, absorb fluids that might be leaking, going to help you with your nutrition and hydration, things like that. But also, what I do is I talk to moms about their support systems and who they might have around them, and maybe the different services, and people that they have around them that might help them be successful in those first few days to weeks of life when you are really healing from a physically traumatic event. And I do wish that I had had that. What I did have, though, was I had a community of other mothers from the birthing center that I gave birth in. And also, I had hired a doula, and they had several mothers groups. And I went to those religiously twice a week for the first year of each of my daughter's lives. And that is what gave me a lot of meaning, and it gave me community, and it gave me people who understood what I was going through. And some people do have that, but then when things go in an unexpected direction where professional support is needed, either for the mom or for the baby, it is helpful to have someone like an occupational therapist there to kind of help figure out what's going on, the underlying issues, and kind of tie things together to make a plan.
Yeah, I can definitely see that when you already said so many things that are needed, like so many things that I don't think like 40 minutes are enough to talk about what are going through their mind as moms and the new things and that their body does. So, because you said doula, I'm curious, would you say that's a common practice in where you are? Like, are people actually using their services that much, or are moms are more prone to still not ask for help?
I think that it depends. So here in Austin, it is a much more common practice to hire a doula. So when I was first preparing to become a mom nearly a decade ago, I had no idea what a doula was. I learned about doulas, midwives. I was like, "What's the difference?" There's a big difference. But I did have a few friends that had used doulas, and there were a few options here in town. And I did find someone who was a wonderful fit for me. And that was really, really helpful for not only myself, but really my husband. Because what the doula does is the doula helps center the care on the mother during the birth and the labor process. And my husband, he's amazing, but he's also never really been around kids before, moms before. And so he wanted to be helpful, but he didn't know how. And so what the doula did is the doula gave him distinct tasks that he could do that would help me through my process. And that was really helpful because it took some of the pressure off of me trying to figure out how I was going to tell him to do that, or maybe be upset when it didn't happen, because you're not even really in your body. Sometimes you're really just very focused on what's the task at hand. So we did use a doula, and now I'd say a decade later, it is much more commonly practiced, and there are a lot more options. There are several different certification organizations, and people are realizing that it's very impactful and it's helpful. And also, research has shown that having that dedicated support around the perinatal period actually improves outcomes. So insurance has begun to pay for doula services in some situations, which is really very wonderful. And it's a great thing that we're starting to accept, at least in the United States, for moms, specifically for moms. I will say that that's the case here in Austin. But I think in many other parts of the world, even the United States, that's not a service that's available to moms or really common.
Yeah, I think so too. Speaking with other people coming from my place in Bulgaria, but it's not common is that people are not seeking help. Like I can see a lot of resistance within new moms to admit that help is needed, not because they're weak or anything else, it's because it's a lot of work and it's a huge transition. And following this, I wanted to ask you, as an occupational therapist, what are the main obstacles that moms are struggling with their daily functioning?
Sure, that's a good question, and I want to first go back to what you were saying about how they're not able to ask for help, or they don't feel like they can. And I think that it's even more than that. It's that, like you said, you go into this period where everything is disrupted, and with the first child, that is literally overnight, which is really, really nuts. And if you think about the percentage of people on this earth that go through motherhood, it's nearly half. And also, the developmental stage of motherhood lasts the majority of someone's life. So it's this huge, huge, very, very common and huge developmental stage that we're really not addressing. And so what happens is that your life gets sort of turned upside down. And as a culture, I think we expect mothers to just know what to do and to take care of our children. And that's our responsibility, feed our children. And so oftentimes what happens is that the brain and the body kind of goes into survival mode. And the last thing that we think to take care of and to heal is ourselves, because we're so focused on someone else. And so what I found when I first started offering these services to mothers is that people who I talked to who had been mothers before, who had kind of are past that baby stage, they were like, wow, I really could have used that. And then people who are in it, they just they couldn't grasp the fact that they could even accept help, because they didn't even know that they needed it. So that's kind of like even the first step, is just telling moms, hey, what you're going through is hard. Healing is going to take some time. And in order to take care of your baby or your child the way that you really would like to, the community needs to take care of you. And so that's why we're here. Um, and then you had asked about some of the common challenges that mothers have in that space. And I think that the first challenge that I've been noticing more and more, especially in the past year or so, as I've been pursuing my advanced lactation credentials, is that there are these drop offs that happen in the mom's mental health when there's issues with feeding her infant. So sometimes that has to do with just the infant's weight gain in general. But a lot of times that has to do with the goal of wanting to breastfeed the baby and not getting sufficient support in those first early days. And at least here in the United States, it's common practice to, have primary care for your baby, to take them to a pediatrician. And during those visits, they're going to weigh your baby. And we have certain medical standards about what the weight should look like shortly after birth. And so, generally, if you give birth in a hospital, they're going to take a weight at the hospital. And then the first weight that they're going to take after that is in the pediatrician's office. And if those weight differences, are more than a certain percentage drop, then the pediatrician is going to recommend that you do something to increase that weight. And usually for breastfeeding mothers who are still waiting for their milk to increase in quantity or still trying to get a hang of breastfeeding, which is very common. We don't have the ability to really watch women breastfeed through our entire lives and sort of know how to do it when it's our turn. So the recommendation is supplementation with formula. But sometimes they're given that advice and that recommendation by their primary care physician, and then not really given support to actually pursue their goals of breastfeeding. And sometimes these things actually can counter each other. And because of that, what I see is that moms lose their confidence for being able to provide for their baby via breastfeeding. And they look to other sources for information about how to do this. And we're at an age where information is just boundless. It's at our fingertips. There's so much information, but it's not always good information. And so that even further, I feel like, drives the mothers to doubt themselves and to look for the right answer outside of themselves. And then we don't have proper or consistent support. So that's where I see kind of the mental health part starts unraveling, where we have this kind of lack of confidence and we have this anxiety and we have this depression and we don't have support. And that can actually turn into a perinatal mood and anxiety disorder, which can be very, very scary, but is actually very treatable. So if we can't get moms help right away, we can really support them.
Yeah, definitely agree. And from what you said about that they want to breastfeed, but because they get anxious because they don't have enough milk supply, what are the main misconceptions about supplement feeding or formula feeding in that sense? So, why are moms actually feeling that they're failing if they can't breastfeed?
Yeah, that's a great question. I think that really the first and foremost one is expectations of what normal physiology of lactation is. So, in general, the breast tissue will start to change during pregnancy. So colostrum, which is the kind of first milk, which is very sticky, it's very nutrient dense, it's very thick, will start to form and be present around 23 or so weeks of pregnancy. And sometimes moms will actually notice that in their own bodies because it will start to leak or they'll try to extract it. And sometimes they won't because they just don't know it's there. But that colostrum is actually designed for a baby right after birth. A baby right after birth who actually has been fed through the umbilical cord through their entire pregnancy. So they're not born hungry. They just need a little bit of nutrients. And their stomachs are very, very small. And they haven't been able to practice really sucking or swallowing outside of the womb yet. So they have to translate that skill. And so that is something that they need to learn. They do have reflexes for it, but they still need to learn to do it at the breast. And so colostrum is actually designed to be absorbed into the lining of the mouth and not necessarily drink the way that we think of babies drinking milk or breastfeeding. And it's just so small of quantity because the baby's stomach is that small, and that is normal for the first few days. So the first 3 to even 5 days of life, you might not have that much milk. It might be this kind of sticky, very small amount. And then around days 3 to 5, we get what's called transitional milk. So basically, as the hormones in the mom begin to change after that birth process, then her milk will start to increase in quantity. And that's what people think of as milk coming in. And some people have this expectation that as soon as the baby is born, the baby is going to be able to drink this large quantity of milk, or at least, it's going to look like milk. And in our medical system, we are very regimented in how much we expect babies to be drinking as well. And so if that colostrum is not as much as the expectation of, maybe the nursing staff or the hospital staff, they're going to recommend to supplement because they're looking at the numbers. And I feel like a lot of moms immediately think that they've failed or that they don't have a good enough supply because they're not seeing that mature milk, but we're not supposed to have it yet. There's a reason, a physiological reason for that. And so I think that the expectation of kind of when milk comes in, when it increases in volume, and what it sort of would look like, and how much the baby would naturally be taking in, we just don't know because nobody's teaching us that, and we don't have other people to watch. And so taking a prenatal breastfeeding class, I think, is really a great tool to kind of help with those expectations too, and the advocacy of
Hmm.
yourself.
And from following that, why is it so scary for moms that cannot breastfeed at all? Like, why are they feeling that they're failing, in your opinion?
I think it's culture. After like around the 80s and 90s, we had this big push as a culture, at least in the United States, to promote breastfeeding as something that is the best option for your baby. And we know that we don't know everything about breast milk still. We're still figuring out how many amazing benefits it has. Human milk is designed for human babies, and it has these incredible immune properties that help the lining of the baby's gut right after birth against microbes and things like that. You can pass antibodies back and forth between mom and baby. The nutritional value of it changes, and so it's really this live food that we give our babies. And so there are some really incredible benefits, but I think that has been pushed to a degree where moms feel like, well, if this is the best option, and for whatever reason I can't give my baby that best option, then I'm less of a mom for that. And I, as a lactation professional, but also as an occupational therapist, I do want to stress that yes, we know that breast milk is the ideal food for babies, but breastfeeding is more than just food. Breastfeeding it encompasses so many things. It's the active participation of both the mom and the baby. We have the anatomy of the mother's breast and the mother's body, and the anatomy of the baby's body and the baby's mouth, and how all of that works together. There's so many complexities, and you have to do it frequently. It's an activity that you're doing every 2 to 3 hours. Sometimes it's lasting, 45 minutes, an hour. Sometimes it's an endless task, and it's repetitive, and it's very hard. And that can weigh on mom's mental health or physical health. And sometimes it's difficult for the baby to do it. So there's lots of factors involved that are more than just the nutritional aspect, that we have to weigh. And I think that's where things go wrong, is that the mom's thinking, culture is saying, hey, this nutrition is best for your baby. And moms are trying to make that happen regardless of barriers that they don't have support for.
Yeah, so they immediately think that they're failing because they know from society that they have to be have to be happy that they're gonna breastfeed and everything. But because you said so many difficulties can appear, and I love that you said like sometimes babies are not doing it also, and it's a two-way thing that happens. So it's not their fault. But I have moms that I know that they're breastfeeding but they don't want to. So I think this is also getting hold on their mental health. So why do you think that they're doing it?
Yeah, well, there could be so many reasons, and it's interesting that you brought that up because breastfeeding is actually driven by hormones. Sometimes sort of scary things can happen in our minds when we're doing it, and that has been actually shown in research to be true because of this hormones changes. So there's something called dysphoric milk ejection reflex, which happens when a baby latches. The person who's breastfeeding might feel for those moments some really scary negative thoughts, or feel very, very uncomfortable or down. And if we don't know that this is something that can happen, it might feel very, very scary. It might feel, you might have an aversion to that, because having sudden negative thoughts and feelings and not knowing where it's coming from, and having that happen to you multiple times a day, associated with an activity that you feel like is good for your child, um, that's really hard. So it's called DEMER for short. So that's a thing. And then there's also some aversions that can happen. Some people have aversions to the breastfeeding process itself. And because it's a sensory activity, um, for some people, their nervous systems, that activity itself it's just too stimulating, or it's stimulating in kind of a noxious way to their body. So even though cognitively they're thinking, this is what I want to do, their nervous system is telling them, well, this is not something that is safe or comfortable. And that does happen to people, especially people who are neurodivergent. And so those things can make breastfeeding something that they might actually feel like they don't really want to do. But there's reasons outside themselves that they are doing it anyways. Um, and then, other things, just like, past traumas can make
Yeah. Mm.
breastfeeding a very difficult task to do. So I think each person, they have their own experience around breastfeeding, and sometimes that experience is mixed with some negative experiences. And we do need to heavily consider that for every individual person, that those negative experiences might actually compound themselves and, turn into something where they're not able to be present for other parts of their own lives and their children's lives. So, and there are supports for that. There are mental health supports for
Yeah.
that. Occupational therapists can also help with that sort of thing. Yeah.
Yeah. That's really interesting. I started to think a lot about what you've said, and also about the fact that hormones and neurodivergent here plays a role here also, which is I would say under researched in many ways, and how hormones are affecting those people too. So I think we have a long way to go in that sense. But what gets me mad sometimes is that I can see that a lot of research is going on about how breastfeeding is really, really good for your baby, and that's amazing. More research should be done. But the thing is, when the title is like cure cancer by breastfeeding your baby or stuff like that, I would say moms who can't breastfeed or have really aversion, as you said, would think immediately, "Oh, my baby might have cancer because of me," or like have those automatic thoughts because they need to be perfect. So it's so sensitive with this target of people. Yeah.
Yeah, for sure. Because, this might be the same type of person who is very anxious and very worried about things that could go wrong. And also the type of person who may have been, very successful in other parts of their lives, doing things, by the book and doing things correctly.
Yeah.
And when you hear things like that, like, well, if I breastfeed my baby, maybe it can prevent them from getting cancer. Maybe it can prevent them from getting allergies and things like that. I think that, we are promoting all of these really potential positives of breastfeeding, um, without thinking of the negatives, actually,
Yeah.
which I think is what you're saying, is that we're really not looking at what mothers are going through in order to complete this theoretical goal. Um, and we do need to look more about that, because breastfeeding is something that it takes up a lot of time. It involves your body. It puts the mother at potential risk for different situations like mastitis or skin breakdown. And so we need to be prepared if we're putting a message out there, um, that is going to increase mothers wanting to breastfeed, to actually support them through that process. And, I myself have gone through the training to be an international board certified lactation consultant. And um, I, it's wonderful that that profession has been developed in response to this need, especially just worldwide. Um, IBCLCs are taught to support moms breastfeeding in, you know, dire situations, such as, like emergencies or, starvation, things like that, where it's very, very important. But a lot of us are in situations where physically we are safe and we are taken care of. And so in those situations, we have to actually also weigh other things. And I think that just saying, well, breastfeeding by all accounts, as much as possible, without giving them really the support that is needed in order to accomplish that goal, in order to actually learn how to breastfeed. It's just like any other motor skill that we have to learn to do. You don't just throw somebody into cold waters with, waves and tell them, go ahead and swim across to that island. You train to do those things. You learn the strokes. You don't just struggle through it, because you might drown. And so we need to provide our mothers support for that goal prenatally, before, when they actually can absorb information, and then also postpartum at many points along the way, as the child develops and as things might change.
Yeah, I definitely agree. And also thinking about prenatal period, I think more and more research is coming out that during the prenatal period is the time that we need to prepare moms in many ways, like also about what is postpartum mental health issues, what are they, how they can appear, because I think what we're looking at is that after giving birth, and by the shock of the surprise that you're not attached as much, or you don't feel happy as you should have, you also are afraid to seek help. But if you know probably before that, you wouldn't have this barrier of the surprisement and shock, so you don't ask for help. Because this is like, there are occasions where help is in front of you, but you don't take it because of all those other barriers of being a new mom and the societal pressure and expectations that comes over her. Um,
Mm-hmm.
Following what everything that we said about breastfeeding, I wanted to ask you about your passion that called milk stories. You shared that with me last time. Could you share it with us?
Yes, yes. So I talked a little bit about, as I've been working with families, as I've been working with more moms and babies, how I've noticed this connection between the lack of support for breastfeeding and lactation and declining mental health. And as occupational therapists, our the basis of our profession is actually in mental health. So occupational therapists initially were called restoration aides, And it came out of needs from World War II, where we had all of these soldiers that were returning to civilian life, and they had gone through war, and many of them had extreme mental health difficulties, and but they really were motivated to return to the life that they once had. They had families, they had had jobs, but they really couldn't access that because they had all of this trauma and this depression and anxiety associated with what they just went through. And so restoration aids actually brought activity to the soldiers, in the form of crafts that they could use to actually make a living. So common ones that we always learn in OT school are, like basket weaving, or uh, leather kind of stitching, things like that. Um, and so occupational therapists taught the soldiers to do these crafts. And what they realized is, as part of teaching these crafts, the soldiers were gaining meaning from the doing of the activities. And not only that, where they were able to translate this activity to something that they could use to make a living and reintegrate into civilian life. And I feel like motherhood there's so many parallels, because we go through motherhood and we had an identity in life before motherhood, and we have a vision of what motherhood might look like. And oftentimes people are just, very taken off guard, and everything that happens could be different than what you expected. Plus, birth and labor and pregnancy are physically traumatic, and sometimes the situations around them are also emotionally traumatic. And so you go through, in a sense, a war to try to come out the other side and realize who you are as a mother and an individual. And so I started Milk Stories kind of with a concept that I wanted to bring back the roots of occupational therapy through those crafting activities and through creating meaning through activity and occupation, in a sense, to actually heal mental health and to start to help people gain an identity of who they are after this huge event that has happened. And so I also, in that, want to bring more individualized support for lactation, starting prenatally with education, and then also hitting those moments postpartum where mothers are most vulnerable to having their mental health affected because something might be going wrong. So, as an occupational therapist who I work with infants and understand oral motor skills, but also understand the mental health component of the mom with additional lactation training, what I want to do is I want to be able to be the clinician, the professional that can help those individualized cases to figure out what the underlying reason is. And then, in addition to that, just kind of help my community bring in that crafting and that doing and that community supportive aspect. So it's kind of a two-pronged approach. I don't know exactly what it's going to look like so far, but what I have been doing is just bringing people together in community settings to do crafts and just talk about motherhood. And so that's what I started with. And we've had some really beautiful groups and some really meaningful discussions. And to just start simple by doing something with your hands and being around people who get you. I think it's a great place to start, and I'll grow from there.
And are you seeing like only people who are pregnant or after delivery also?
Both. In fact, my groups are a mixture of pregnant and postpartum moms.
Okay, and can you give me just an example of a craft that you do?
Sure. So around Halloween in October, here in the U.S., I just got a bunch of pumpkins, and we painted them. So, expression of art, creativity, and something that, I tied in with the holidays. And then to be extra creative, I made my pumpkin into the anatomy of a breast. So I painted it like the internal anatomy of the breast so that I could also use it as an educational tool. So we did talk about, what happens to your breast prenatally and postpartum and kind of how that changes. And so it was just a really fun activity.
Okay, that's really amazing. Now I have like a specific idea because I was curious. That's really nice. Um, I wanted to ask you because you said that you're doing a doctorate. Is it also in the lactation field?
So I finished my doctorate in 2023, and that was a post professional doctorate in occupational therapy. And my project there actually was related to looking at how occupational therapy can support parents with physical disabilities, because that is a
Okay.
population who have unique needs and experiences. And traditionally, occupational therapists actually help people who have gone through, illness or injury or disability to figure out how to do things after that. And but we don't really have much for motherhood or parenthood, so that was kind of my project. But during my process finishing my doctorate, I also started adding on more education and training for lactation. So it kind of happened in parallel.
Great. And I'm really curious, was there a specific moment or an event that really triggered your passion around motherhood? Because you said that before being a mom, you were an occupational therapist, but when was the point that you started focusing on moms?
It was COVID. So during the pandemic, I was working part time as an occupational therapist in the hospital, and my kids were young, like toddler and preschool age. And I remember very clearly the first month or so of lockdown. The hospital cut hours for anyone who wasn't full time. So I didn't have the opportunity to work, and my children were not going to school. We couldn't see friends and family. We were just kind of here, and but I could talk to my friends on the phone. And what I started to realize was that mothers were, I mean, parents in general, but particularly mothers, were put into this position during the pandemic, at least during the start of the pandemic, where um, a lot of what was meaningful, there are meaningful occupations like, work or school or leisure or social participation, were all eliminated just overnight. And but what they did have was they had these responsibilities and roles as mothers. And then all of a sudden it was, if they had school age children, well, now we have school on Zoom and you have to facilitate it. Or if you have, young kids like I did, well, now they don't have school, so we have to think of activities to entertain them. And so our roles as mothers kind of expanded to include all of these other roles of caregivers who were also helping our children develop and grow. Um, and that was hard. It was really, really hard. Plus, many of us had partners or family members who were also living in the household, who were also trying to work or trying to, figure things out. And so you've got, this family life and this motherhood sort of like condensed all in this small space. And then there's fear around the pandemic and what's going on in the world and people getting sick and keeping your family safe. And so the reason why, when I went back to school for my doctorate, I wanted to look at that. I wanted to look at what was going on with the roles and the occupations of mothers during COVID. And that's sort of where I started, and where it ended up was me starting a private practice with a colleague to actually make a difference in that area. So yeah, it was a global pandemic and being a mom.
Yeah, it's a kind of a funny thing that a lot of people have been triggered by this pandemic, doing a lot of things to help people. Because I think it's a really interesting experiment to see so many people isolated and see what we're lacking as a society, like what needs are not met overall. um as a last question, because the time is going forward, I'm really curious now, going forward from that day on that you began to be an occupational therapist focusing on moms. What is the one thing that you really think that needs to be changed now, like that really parents overall are struggling because of it? So what should be changed now?
Oh gosh, that's a hard question. But I guess I will give you my most simple answer, and that is that somehow I would like to encourage mothers and parents, that they know their children best. They are the experts in their children. Even if you're pregnant, you're still the expert in your baby. You have been carrying that baby in your body and communicating in different ways. You know their movements. In some ways their routines. And once these children are, out into the world, you're the one who's spending the most time with them and really getting to know how they communicate and their routines and their rhythms. And that makes you the expert. That makes you the person who knows the most about that other person. And also, physiologically, parents and children are designed to bond with each other and to get to know each other and to start to develop rhythms together. And that is very valuable and it's very powerful. And so, the thing that I would like to do to make changes is just encourage parents to know that they can trust their gut, that they are the experts, and that if you have a feeling that something doesn't feel right or something's off, you're probably right. So find the right support, somebody who backs you up, someone who you really feel gets you, and the right fit. And that might be a friend, it might be a piece of information, or maybe it's a professional. Um, and also just, trust your gut.
Thank you. I really love that. And I couldn't agree more. Thank you so much for sharing everything with us, Jessica. That was really insightful.
You are so welcome. Thanks so much for having me.